Hello and welcome to We Care Wednesday at Hawthorne Pharmacy. My name is John Floyd, and today I'd like to talk to you about a few minutes about men's health and more specifically preventing prostate cancer. As you know, men are a little more stubborn and hard-headed when it comes to going to their doctor for wellness and preventive care visits. So I want to stress the importance of preventing disease and especially prostate cancer, where early detection is so crucial as it is with colonoscopy and preventing colon cancer and detecting skin cancer or melanomas early. The earlier you detect these kind of situations, the more positive the outcomes are. So getting to your doctor for these wellness and preventive care treatments are important. So getting back to preventing prostate cancer, let's look at the risk factors that are involved. So number one, if you're a man over the age of 50. Two, if you have a family history with a close relative such as a brother or a father that's had prostate cancer, you're at higher risk. And thirdly, African American males are at higher risk for developing prostate cancer. So as I mentioned, at the age of 50, our prostate gland, as we grow older, tends to grow slowly over time. And if it ever gets to the point that is large enough, it can start to present symptoms to us such as frequent urination, especially at night. We can have a weak urine stream. We could experience painful or a burning sensation upon urination. We may have difficulty in stopping or starting our urine stream. And lastly, there could be blood present in the urine. So certainly if you are experiencing any of these symptoms, you want to visit your doctor sooner rather than later. But we want to get there so that your doctor can do some screening for you, some preventive screening. So what would that include? So if you went, he would do some blood work, and based on your blood work, specific to your prostate gland, he'd be looking at a PSA level. And a PSA level is just measuring for an antibody that's specific only to your prostate gland, is a protein-specific antigen. So if that comes back in your blood work, that marker comes back elevated, your doctor is going to see that, and then he will probably want to do a digital rectal exam in the office to see if there's any abnormality there. If he determines one, that there was an abnormal digital rectal exam and that you had an elevated PSA level, he may at that point request that you have a biopsy done of the prostate gland, in which case he's going to send that off to determine if there's any cancer cells. The good news there is if it does come back positive for cancer cells, catching it early, the treatment and outcome is very positive. However, if we let it go untreated, those cancer cells can spread throughout other regions of the body, and then it becomes more difficult to treat. So that's why going for those preventive wellness and visits with your doctor so that he can screen for things like this are very crucial and important to the outcome. So I just want to make sure you take that. If anything you take away from what I'm telling you today is go for those routine wellness visits. But if it comes back that it wasn't cancer and that it was just enlarged prostate, then that's what we call BPH, or benign prostate hypertrophy, which can be treated with medication and then monitored over time with follow-up visits. And another condition that might cause those symptoms we discussed would be an inflammation or infection of the prostate gland, which may or may not have or present with fever. But again, that can also be treated with medication. So again, the big takeaway, guys, take charge of your health, go to your doctor and see him for preventive wellness visits and screen for conditions such as your prostate gland, your colon, skin cancer, and things like that. Again, getting these things early is crucial, and they can only be detected early if you go visit your doctor and take charge of your health. So thanks for listening, and have a blessed day. Bye-bye.